Today we're going to talk about Botox to the forehead. When clients come in, there's two concerns that are usually brought up. There are lines that happen in between the eyebrows, referred to as the 11s, and there are lines that happen across the top of the forehead, the frontalis here, horizontal lines. Typically, it's best to treat both lines. Those are two muscles that are friends, they work well together, and if you don't relax both, you will not have an optimal outcome. So normally we do address both areas when treating the forehead. So after we address the client's concerns, we usually use a marking pen to mark on the forehead where we're going to inject. This helps to allow the client to relax during the injection process. The average dosing for inside the eyebrows, the 11s, is anywhere from 20 to 25 units for a female and 30 to 35 units for a male. And the average dosing for the frontalis, the horizontal lines across the forehead, is anywhere from 12 to 15 units for a female and 15 to 20 units for a male. It's important that we do optimal dosing. Underdosing or not treating to full correction will allow the Botox to not last as long. Normally, typically Botox should last about 3 to 4 months if dosed appropriately. So that's one of the important things we usually discuss with our clients when we're discussing dosing. When we're assessing a client before treating their forehead with Botox, there's a couple things we look for. We definitely look for their muscle movement. Everybody's a little different. Everybody's anatomy is different. Their muscles move differently, and that's why dosing ranges. So you may not get what your friend got. You may not even get what you got last time or what you may need next time. We treat what we see at the time. A lot of times for someone like our client here is we'll stay in the middle of her forehead here so that we don't cause a heaviness on the outside of her brows. Some of our clients have a lower set brow or a heavy lid to begin with before we treat them, so those are all things we have to take into account when dosing appropriately. Setting expectations is an important part of our appointment time. So we always let our clients know that Botox does not kick in immediately. It can take 3 to 4 days on average to start to work, and it can continue to work for up to 2 weeks. We like to follow our client in 2 weeks after it's peaking or at its maximum point and add a little or do a little touch-up if necessary. Once we get to know our clients, it's a lot easier to know what they need and where they need it. There's also some post-care that goes along with Botox. You want to make sure when you have an appointment that day that the rest of the day you can take pretty easy. You must keep your head upright for a minimum of 4 hours. There's no massages and no gym, hot tubs, or saunas for 24 hours. Okay, so that was as simple as it gets to get Botox in the forehead, and subscribe to our YouTube channel for more tips and tutorials. Thanks for watching.